You've landed on the Gaslit Truth Podcast. We're your hosts, Dr. Teralyn, a therapist, Jenn. And today we have a big topic, probably one that's going to be a little personal for both of us, I think. You've probably heard of the Lindsay Clancy case in the trial and all the stuff about her. But today we are talking about the civil lawsuit that was filed on behalf of her. So we have a little disclaimer.
Yeah,
The disclaimer is we're going to be talking about some things that are super uncomfortable, super triggering. And yeah, so if you feel like this isn't the show for you, maybe today is not your episode.
Turn it off today, right?
Turn it off. Turn it up.
Yes.
Here's your one and only disclaimer.
Yep, that's the
All right.
disclaimer, guys. So Lindsay Clancy, she is accused of murdering her 3 children. Cora is 5, Dawson is 3, and Kellen is 8 months before cutting her own neck and her own wrists. And she jumped from a second-story window then on January 24th of 2023.
She also swallowed a bunch of pills too on top of that.
Yes, she did. Yes, she did. So, so we are in the middle right now of this trial. And so we're going to break some of this down. There is a lot of bullshit that is flying online about this case. And what we are going to tell you today is the things that Terry and I are going to bring you. The facts that we are going to discuss are coming straight from this wrongful death lawsuit that was filed in January of 2026 by Lindsay Clancy's husband, Patrick. So we went through all 784 pages of this motherfucker, and we're going to give you,
I would encourage anybody to read it. Like it is really good.
It's fascinating. Let's not take what media is throwing at us. This is as close as we can get to the facts. So let's do it. And the trial is covering these pieces of this too. So we're not the first to talk about this here, but I think it's important to talk about this in terms of psychiatric med harm and what can happen, as well as postpartum.
Right.
So
postpartum depression and postpartum psychosis. So yeah.
Right. So
anyway,
we'll dive into this. All right, here we go.
By the way, she is also paralyzed from the chest down from that. Yes. So she will also never be the same. And you know, people are going to be arguing, but she took her kids' lives. But this whole thing is crazy town. It's an example of what happens when people don't talk, collaborate, take history, and they overprescribe willy-nilly. So, yeah. Anyway, should we start with that?
Yeah.
For prescription stuff? Oh my God.
Let's start with that.
Okay. So I'm going to make this statement. I believe it was 8 medications over the course of 13 days. I believe it was 13 days. Like it was a very short amount of time. It spanned, maybe it was a little bit longer than that. Hold on. I don't want to mislead anybody. The first medication was given in October of 2022.
Yep.
The last one was given in January.
Yep.
Yeah. So October, 3 months. Sorry, not 13 days, 3 months. And I think somebody's missaid that on one of the videos I watched too. It was, they said over the course of 2 years. Well, I think that's because it was in the end of 2020 and the very beginning of 2023 is when all this went down. But the medication list was insane. The stuff she was given. I have the list. I'm going to find it right here. The list of things that they put her on and off. Let's see. We're going to start with Prozac, Ambien, Remeron, Klonopin, Seroquel, Valium, Lamictal, and Trazodone. I'm sorry. She had previously been prescribed Zoloft as well. So we've got SSRIs, benzodiazepines, sedatives, antipsychotics, and mood stabilizers / anticonvulsant Lamictal. And
Z-drugs.
Yeah, on, off, up, down, all the things, which we know just starting and stopping increases suicidal ideation.
Yes.
And I'm going to just throw in there homicidal ideation at the same time.
100.
Yeah. Self-injury, basically.
And I think something that's important with these medications to talk about too is the adverse reactions that this woman had in very short times from taking these psychiatric medications, which is one of the
Like,
arguments
immediately.
that the defense is making, right? Is that they're talking about a bipolar disorder for this woman, okay? And
Which, okay,
okay,
let's back that train up for just 1 second, because this whole bullshit about if you start a psychiatric medication and it makes you go manic, that means you had underlying bipolar disorder is not researched. That is not settled science. It is not evidence-based. It is a narrative, essentially. It's just
it
a
is a narrative,
because we don't know.
That is the hard part. They have an expert that they brought in that actually at the end of this, a psychological expert did come in, and that it is discussed in this action lawsuit. And that expert did a full entire history report on Lindsay, met with her over the course of, it was like 6 months, a couple times for multiple hours. Okay, all the things, they put this in here.
I think it was like 8 hours total or
which
something.
is like whatever, is arbitrary. I do an assessment with somebody and I spend 6 hours on it. Who the fuck cares how many hours you spend on it? It's so arbitrary. It doesn't matter. What we need to know though is what the argument in here is they are trying to make a plea that there was like mental insanity that was happening at the time. Well, of course there's fucking mental insanity happening at the time, but the world wants us to put a label on her. Okay, we need to actually put a mental health diagnosis on this girl to plead insanity. This is the argument that's happening. And so what they're saying is because of her reactions to medications, the medications that she was on initially, and how terrible those reactions were.
Oh my gosh.
We're building a case from the jump that the providers were negligent, because when someone has a reaction such as that, we need to consider bipolar disorder, underlying bipolar disorder.
That's the
right
whole
away.
deal. That's the whole
Carrie
deal
and
right
I
here.
are, this is the biggest thing in this action lawsuit that we're like, that's bullshit. There's no science to actually
saying
prove
that she
that
was never treated for bipolar disorder correctly, like with lithium or something, right? So she
Yes.
basically, in my humble opinion, we didn't give her enough medication classes to know if one of them was going to help her, right? If we would have just given her lithium, then maybe none of this would have happened.
But
right?
here's the deal, guys. Here's the deal with this one, though. Because of the science, I'm so air quoting this. I hope you guys are on YouTube. I'm always fucking air quoting stuff. Because of the science behind this is the only way that someone like this could try to plead insanity, is for us to create that there was this underlying diagnosis that existed there. And the reason for this is because there isn't enough actual, I shouldn't even say there's enough research on this. There isn't actually research out there that is proving that underlying bipolar disorder is something you need to go to when you are, like, when certain medications aren't working effectively for you, then we need to start looking at bipolar disorder. But that's the problem with this whole entire thing, is there is enough of an argument that these medications caused this.
Yes.
Okay. Yes. Not an underlying psychological diagnosis, that the medications actually caused it. However, do you think that would really be accepted in a court of law? I mean, that's the conundrum in this whole thing, right? And if Toby Watson were sitting on the show right now,
I wish
Toby
would be. I know
Toby would be like, actually, because he's an expert in this. He would be like, actually, no, the way this lawsuit was written is inaccurate. The way this lawsuit needs to focus on that the actual psychosis and everything that happened with this woman was caused by the start of this, which was your Zoloft.
Let me read this off because this is in the very top. I think we're on page 2. Basically, it asserts that each of her providers failed to properly diagnose her bipolar disorder with postpartum onset, and instead subjected her to a disorganized, uncoordinated course of polypharmacy that exacerbated her condition and precipitated a severe psychotic break. And so they're saying, again, they have to say they misdiagnosed her. That's essentially what it is. They misdiagnosed and mistreated her, which probably is all true.
Well, I mean, we need a diagnosis to do treatment, right? That's how our world operates. Like this is the world of Western medicine and how we operate. So you've got to have a diagnosis to be able to do the treatment. The thing that really was grossly overlooked, and they're not wrong in this, is her adverse reactions to quote unquote low dose medication. That's written right on there on page 10.
The low dose BS. A
Which
dose is a dose.
Right.
Mhm.
So we were on a dose, and right away, because of the adverse reactions, Lindsay was taking Zoloft, and that got discontinued right away at the jump. And she was prescribed Ativan and Benadryl because she was feeling awful. This mom was not sleeping. She started on a dose of 25 milligrams of Zoloft, brought it up to 50 milligrams of Zoloft, and it was she didn't sleep. She had racing
Mhm.
thoughts. Her anxiety got worse. Things got totally worse. So the very first step of this was the prescriber discontinuing that Zoloft and prescribing Ativan and Benadryl just to help her sleep. And it even says in here, guys, which I think is interesting, even after carefully tapering off of those medications,
What does
which
that mean?
who knows? Who knows, right?
Right.
Don't know what that
There's
means.
so much we don't know what it means.
Yeah,
Yes.
but
Mhm.
her profound insomnia was so bad that she started having cardiac palpitations.
Yeah.
Okay, so then we start to bring in some of the medical pieces of this, and she
Mhm.
continued to deteriorate. So this was the start of this, was that drug for her. And I don't know,
Well,
Terry. Oh,
we're
go
gonna
ahead.
back up just a minute because she had 2 pregnancies before this,
Yes,
and
let's talk
that
about them.
that is actually the history piece that they're saying was also missed because she
Yes.
did struggle with postpartum issues after these. Now, there's one really curious part here. So she had her first child and didn't really report anything as far as postpartum stuff goes. The
Yep,
second the
nothing.
second child was where, there was some postpartum anxiety,
And almost manic. Her husband
elevated
said
move.
manic
Yes.
behavior.
Manic
Yes.
behavior, increased energy, decreased need for sleep, obsessive cleaning, racing thoughts, and excessive activity.
Yes.
However, the interesting part is the interventions that she
Yeah.
chose were
Quote,
eat, sleep, move, meditate.
right. Symptoms resolved through
Yes.
exercise, healthy diet, meditation, and several therapy sessions.
Yes.
So here's
Exactly what Jen and I
pregnancy
talk about.
2. Yep.
Yep.
Eat, sleep, move,
And they
meditate,
resolve. Mhm.
and they resolve for her.
Yep.
So that, I think that part
No psychiatric
matters.
interventions.
None
None.
whatsoever. And then
Mhm.
comes her third pregnancy.
Yes.
Yes.
And that's when she had excessive manic type behavior. She even ran a 5-mile road race at 5 weeks postpartum.
Yes.
5 weeks. I couldn't even
Yes.
walk upstairs at 5
Well,
weeks.
pretty sure I felt like my vagina was still falling out,
Right.
like
Yes.
month. Now, okay, this is her third child. So for those of us who have multiple children, let's be fair, each time gets a little bit easier. Okay, it does. That's not a blanket statement. I'm not a medical doctor, but for the most part, I mean, by your fifth
Kinda
kid, kind of
does.
falls
It
out.
kinda
You're in the
does.
elevator
Yeah.
and you're like, fuck, the kid's coming out, right?
Yeah.
Okay. But that part, I want to read this, guys. This is what was happening after her third child. Okay. She had significant hypomanic behavior, which included extensive program of exercising, which started 1 week after delivering her third child. Woke up every day before the kids got up at 4
Like
a.m.,
4 yeah, I was gonna say like 4 in the morning or
running
something.
3 miles, doing 30 minutes on her Peloton, another 30 minutes of aerobic activity. And then 5 weeks after delivery, she had run a 5-mile race. So that is very intriguing, even from a hormonal standpoint,
Yes.
right? Like for a
Mhm.
woman to be able to do that 5
Right.
days after you have your baby, right? You start
Mhm.
doing this kind of stuff. Even her
But I'm gonna
family.
tell you, Jen, I gotta say, like, if you were to go to the doctor and tell them, "Oh, yeah, I'm starting to exercise again. I'm running, whatever," and she looks pretty healthy, she looks pretty good. I'm gonna tell you what, that would be not discouraged.
Well, it depends on what you're reporting. But then did you also report to
Right.
the doctor that at the same time, you bought into a whole beach body, like pyramid scheme thing, and you are now spending your life doing that, purchasing
Mhm.
products, reselling, getting family as part of this to join the
By the
like,
way,
let's
I
add it
just wanna
in.
say she was also a labor and delivery nurse.
Yes, she was. Oh,
Okay,
yes, we did
so
say that. Mhm,
yep. So to
mhm.
me, that should not be overlooked in this conversation that she does see. Well, I mean, labor and delivery, you don't really see too much postpartum stuff, but she would be well versed in it to know
Yep,
what is appropriate after birth and what would not be appropriate after birth, right?
right,
What your body
right.
does. So
So the
yeah, I
argument
think
here is yeah. So the argument
mhm,
here in this lawsuit is that like these postpartum behaviors and how
mhm,
early on they came, they constitute this hypomanic episode. And when you pair that with her last pregnancy and the history of what she went through, right? Even though she resolved those symptoms with eat, sleep, move, meditate. These are suggestive.
Shocker.
These are suggestive of underlying bipolar disorder. This should have been caught. I don't agree with that. Okay.
I don't agree with it either. I think there's other things at play. Obviously, postpartum things, hormonal things, and probably lack of sleep. Like that's a huge issue. That being said, what happens postpartum to women, because it happened to me, is super fucking scary. Okay. And super risky. So we're not diminishing the idea that she needed some sort of help, right? Like some
Correct.
sort of intervention. So I want to throw that out there right now so that you're not like, well, then what are you saying? They don't deserve intervention? No, they absolutely do because of what happens, right?
Yes.
But
And that's
it
what
makes
she
me
did.
wonder. She reached out for help a lot.
She is the reason. She is the reason.
Yes.
So throughout this, and we're not going to go through every one of these, but the amount of times that she reached out for help, her husband reached out for help. I mean,
yes,
it's unbelievable. There was a
her husband was calling people. He was
Yes.
showing up with her appointments and saying how desperate she is, like all the stuff.
Her family came in from out of town to care for her children and help because she couldn't. So you've got family wrapped into this. You've got mom going to appointments and being with her during this. So this is not a woman who was there. There's no collateral on asking for help. And that's part of the
hotlines. She called
hotlines. She did an inpatient treatment program specific. So we're going to get to that, right? So
this is why her being a nurse is important, because she knew the resources available and she tried to get them. Like she went and went and went. So that's why this is important. Yes.
So, So the first appointment that she had, they gave her the Eidenberg postnatal depression scale, which was given to her a few times. Okay. Which she probably was no stranger to this. At all within the field that she was in, right? And she had a high score. It was the mid-20s, can't remember what it was. So there was a severe depression diagnosis that was given. And so at that point, she was prescribed Zoloft, even despite the hesitations that she kept having. She didn't want to take meds, guys, because of breastfeeding.
Right.
Was her thing.
Which I don't believe her. She didn't want to take them for her second kid either. But she didn't want to take Zoloft. It was offered the first time with her second kid. She said no because of breastfeeding. And then she did eat, sleep, move, meditate.
Yes. And so this time around, she waited a couple weeks, but then she ended up taking that prescription because she didn't know what to do.
Because I believe she fell into kind of a deep depression after the mania stuff happened. She fell down into a deeper depression. And that kind of freaked her out.
So then she lands herself in the emergency room. Okay. So that's like the next role of this, right? And she's at South Shore Hospital in the emergency room asking for help. Insomnia, anxiety, and heart palpitations. That's where our trazodone comes into play. And that gets prescribed. And that insomnia actually ended up leading to the Prozac as well. That was the next one after the trazodone. Then came the Prozac for that. So, and again, the reactions, guys, that she was having, she was on Prozac for 4 days. 4 days. And her insomnia was so bad. I mean, it just took it to a whole nother level for her. And so what do? Well, then we discontinue it. So, and we all know that the ability for the body to develop a tolerance to a drug happens very fast. So I don't want to hear the whole, it was only a week you were on it.
Well, right. But you have to take it I can't speak. You have to take into consideration all the other meds she was on too, like on, off, like her brain was just in this state of like shock probably.
Then the part that really gets me is after she went off of those, 4 days later comes Ambien, Remeron, Klonopin.
Yep.
All at the same time, guys.
For somebody who is so fragile and expressing how fragile they are, expressing all of the side effects they're having, but they're not looked at as side effects. They're looked at as a mental health disorder. Okay.
Right.
I think if they would have been looked at as side effects or effects of the medication, let's be real, this whole picture would have changed. But again, we go back to when you're a hammer, all you're doing is looking for nails. Like that's it. She was nailed. Like that's it. everything she would say would get a new medication or a new dose or an addition or a subtraction or a complete dismissal altogether.
And this point, I think that's important is right here when this happened, when she started taking it talks about the Remeron specifically, but when she started taking that, then the actual dissociation part, which hadn't been in play yet, now this comes into play. Her world was she could not perceive her world as real. She was disoriented. She was forgetful. She couldn't drive, guys, and she couldn't be alone. So
but yet
that's
she
where
wasn't
this
enough
starts.
of a threat to herself to.
Yes.
Yeah. Okay.
So,
go ahead.
so we're near the end of, we're in November here of 2022, right? So it's not that we're kind of doing a timeline here for you guys.
This timeline is short. Like this
It's
is
super
such
short.
a short timeline.
Yes. So you got those 3 drugs. Then 4 days later, she sees another nurse. And she tells the nurse she's anxious, she's frightened, she doesn't know what the fuck's going on with her, right? She blames herself. So then the nurse says, maybe you're bipolar. So here's the first discussion of a possible bipolar diagnosis. And the Seroquel gets added. Okay.
And that's when all the things took a real shit.
And then suicide. So here comes the suicide, guys. So
yep.
That's when everything shifted very quickly. And then she started to become suicidal. Intrusive thoughts started. And there wasn't a significant, at least from this report, it doesn't seem like there was a significant amount of time trying to listen and understand what an intrusive thought actually is on the part of providers. But that shows up throughout this report too. But then the Seroquel starts and the auditory hallucinations and the voices. Yes. I will not be the same. I want to die.
Yes. But here's the next part. She goes into her provider and it was described as emotionless, like a zombie, attributing this profound affective blunting. So a blunted affect is like a flat, emotionless face and body to the Seroquel. So the Seroquel was blunting her and disconnecting her from herself. Like when you're blunted like that, it's like you are floating through time. Like you are not your body is a shell at this moment. So that's what she was going to.
That's a really common side effect of Seroquel, by the way. Like after Thorazine came and went off of the market.
Shuffle.
Oh man. Oh, the guys in the prison who were on Thorazine.
Oh my God.
The shuffle. The Thorazine shuffle. That was the thing. Like Terry and I got to see that first person real time. But this is a super common side effect of Seroquel. You talk with anybody who's taken Seroquel, the first thing they will say to you is, I feel like I am a zombie. Completely disconnected zombie. I cannot tell you more fingers and toes I have heard that. And they do, right? So then we talk about the metabolic things that are happening to this girl. So very quickly, she loses like 15 pounds.
15 pounds.
This is going on in the background too, right? Some little, she's not eating and she's having panic attacks. And that's over a handful of days, right? Again, guys, we're not talking about a year or 2 years worth of med shifting here.
Months. Like this was just months. All months.
Yes.
This was in not even 2 months. We're talking about, now we're in early December.
We're in early December.
So not even 2 months after all this stuff started.
So she calls a suicide hotline. Let's talk about that. And
oh my God.
We did a show, guys, on our show here. We did a specific episode on
Rob Whitepond.
Rob came on and he talked about those suicide hotlines and things that you need to be aware of when you're calling the suicide hotline, including your information and how not confidential it is, even though you think it is. Okay, that's not what we're going to talk about today, but Lindsay did that. She called the suicide hotline and she was told
she wasn't bad enough.
No emergency. Not bad enough.
Yeah,
so first time she's told she's not bad enough. This will be a theme that keeps popping up here. And it was because she did not have a specific plan of how to kill herself.
Which is complete bunk. Like that's complete idiot. Like she's a mom calling a suicide hotline saying she's scared about her thoughts. And they're like, do you have a plan? Well, no, but my thoughts are incredibly real and scary and all this stuff. Oh, nothing to see here.
Yes. Yep. So then she gets dismissed.
Center.
She gets dismissed from that one.
One day later. Well, she met virtually. 1 day later after she called.
Yep. Yes.
Mhm.
So
Same thing happened. Who
So
are
then
these people running
then
these
comes I don't
hotlines
know.
and crisis centers? Like,
And
what?
then comes her husband, right? Then we're in December, first week of December, right? And her husband
This is all 2 days. This is
2
a span
days.
of 2 days.
So
2 days.
Patrick is going
Mhm.
with her to the provider and to the nurse, and he is saying she is 10,000 times worse since you
Mhm.
started these meds. He sees
Yes.
it, he recognizes it, and his suggestion is, can we get her off of
Get her
these?
off. Yes.
Start from scratch, right?
Yes.
Which, right, here's what he's asking as the layperson going, I don't care here's what I'm seeing right in front of me. We started
Yeah.
these
Which
interventions,
that's
things are getting worse.
collateral information. That should be really profound, right? That should be really
He
profound.
says, is there a mistake? Like, are you
Mhm.
actually prescribing to her the wrong stuff? Like, is there,
Yeah,
you know, so
something
which
is off here.
I'm
Mhm.
sure that nurse's ego probably got the best of her, and she acknowledged it's possible, but then increased the Seroquel up to 400 milligrams a day.
Like, what the fuck?
Okay. So,
But this is what so many people go, like, I don't feel good, I think I need less, or I would need off, increase the dose. Like, that is
yes.
always the response. And, mm, okay. That was
1 week
December 6th.
1 week
Mhm.
later,
1 week
Patrick
later.
does the same thing again. He calls a week later. He calls the nurse's office and says her thoughts are horrible. She is getting worse. So we are a week post increasing that Seroquel dose. Okay.
Mhm.
He calls and
Hallucinations
says
all day, every day, he says.
all day, every day.
Yep.
2
I will
days
never be the
later,
same. I will never
there you
be
go.
me again. You are
2 days later.
damaged. You will never be the same. The only option is to die.
So the hallucinations are changing.
Mhm.
This is important. The actual content of the hallucination is shifting. So, from a clinical perspective, right, this is like if you're doing a suicide assessment or you're doing a mental health assessment on symptoms. We don't have symptoms or statements that are staying neutral or changing to the positive. That's not happening at all in this, at all.
Not at all.
It's growing, and the content of the hallucination is
It's
changing, which is a huge red flag for any clinician, right? It's the difference between someone saying, I passively have this, or I'm just feeling like I just can't live anymore, versus
Yeah. If a meteor hit
your
me in the middle
option
of
is
the
to
night,
die.
I'd be okay with it. Right. This is
Yes.
saying you need to
Yes.
die. And then it
And
changed
then
to
right afterwards, then she says to her husband, I have thoughts about harming our children.
and her mother. She told her mom too.
And her mom.
She told them both.
So the delusions now become, they're paranoid. They are,
Mhm.
they very shortly, I mean, they're starting to go into the command hallucination realm, right? Like you're
Mhm.
going from I'm having these thoughts to the only option is to die to what's going to come out of our mouths next, which is the next phase of these. Like if you would just write down the exact things that she reported for her hallucinations
God.
and pull everything else out of this entire picture, that right there is screaming, we need to take this woman, we need to put her inpatient somewhere and keep her there to keep her alive.
Yep. And to
It's that
keep her
simple.
from harming her children. Yes.
Right. So
But she was so
that's
scared. She was so scared that
I
to be
know.
locked away. And this is
Mhm.
funny because in the psych med harm community, like there's this whole push to keep people out
I know.
of inpatient stuff when they are saying they want to hurt themselves, they want to hurt someone else. When we do that,
Yeah. There's a double-edged sword here for us too. And we've talked about
double-edged
this.
sword.
We've talked about this on the show. We have actually had guests on that have been so incredibly harmed by inpatient treatment.
Yes, that happens too. Yep.
Beyond, guys, right? So for us, we have to consider all sides of something.
Mhm.
When it comes to somebody's safety, obviously Terry and I are going to have a different view on that too, based off of not only our personal views on this, but our professional views on this too, because this is our training, right? As therapists, like if we have somebody who is in a space like this, we're not safe land. Others aren't safe land.
Right.
And there comes a point where decisions have to be made in terms of, could more harm come from an inpatient space? Yes. However, you're alive and we're going to work you through it, versus you're not here anymore to even have
or
a
your
chance.
kids or somebody else or somebody, all these things. So yeah, this is
So
to me, that was the most profound part
I know.
because like of all of the mismatched stuff and whatever.
And that part bothers me because it wasn't a provider who said, we need to put you somewhere. It was Lindsay then who prompted a visit to the emergency room.
Yeah.
So she, once again, reached out.
Said, I need help.
Got herself there into the emergency room. Yeah. And then that was the emergency room is the one that actually suggested that she do this day program at that women in infants hospital in Rhode Island. So they were the ones that had said to her, yeah, like maybe this is something you should consider. Right. And so she did.
Yeah.
Yeah. So she checked herself in there. Here is her chief complaint. I feel numb. I feel crazy. I feel depressed, numb to all emotions. I can't feel love. My life is becoming a disaster. That's her intake, guys. She can't feel fear. I can't feel fear. Oh my goodness.
God.
I didn't even catch this when I was reading through this.
That didn't even scare me to think about that stuff. Like
I didn't even catch that. Yep.
I didn't either.
So
But
when you
that's
you
profound
can't feel
because
fear.
like you're not afraid to then follow the hallucinations, to follow the commands.
Correct.
Yeah. Right. That is new. And then they did the postnatal depression scale again. And her scores were elevated, but Dr. Diaz at Women's and Infants concluded Lindsay had no postpartum depression and rejected bipolar disorder diagnosis because of no history of hypomania or psychosis or family history. But he didn't even do a history. He didn't even ask about the history. And that's the whole part right there that kind of the nail in that coffin.
And that
in
that
my
right
mind.
there is, they use the word negligent in here. Yeah, that is absolutely fucking negligent.
The only good thing that
100%.
the clinical team did say that her symptoms were more pharmacologically induced than purely depressive. I agree with that. 100%. Yeah, she would have not been here in this space if not for all of the polypharmacy in a short amount of time, or just polypharmacy, period. I do agree with that. I do agree with that.
Yeah. But how much we hinge on this stupid bipolar diagnosis.
Oh my God.
Because the reason for this, right? Every bipolar diagnosis was
legal
rejected.
hole.
That it is. And that's the whole thing about this. We are putting so much goddamn stock in a label that we are missing. We are missing what's actually happening in front of us, because it's all about, you don't meet the criteria for this. You don't meet the criteria. It's arbitrary. Like if we want to really help somebody, we need to stop looking at a label and look at the symptoms and at a timeline. That's real collateral.
Yes.
A bipolar diagnosis is not real collateral. It's not.
It wasn't going to change anything except to add another medication that probably would have harmed her still. Like,
right.
You know?
So that's the whole thing of this thing, right? When it's all said and done, having a insanity diagnosis, like given because of a mental health diagnosis, right? Like in our justice world, those two things have to go together, despite how, despite.
Yeah. Well, I just keep thinking like you couldn't, I don't know if you could do an insanity plea. I'm not a legal, so I don't know if you could do an insanity plea if you were taking psychiatric medication as prescribed, as whatever, and you still did this thing, because those are supposed to be the things that help you the most. I remember cases in the prison of people going off their medication, committing a crime, right? Which now I think, well, if you're on and off, like, anyway, but the judge holding them accountable for not being medicated.
Yeah.
Like, if you would have been medicated, if you would have followed the rules, right? I'm thinking, well, then if you would have been medicated and still did this.
Yep. And she did. I think that's one of the arguments on this is she did follow the rules. She did take the medications as prescribed. She got off of them when they told her to get off of them. So
probably because she was a nurse.
She did. She stayed in her lane with what she knew and what she had learned, and she followed the providers. So you don't have a case of somebody who was going on and off and willy-nilly this. And no, she was actually following the treatment plans that the providers were giving to her. Which,
well, then this women and infant program said that she wasn't appropriate for them, but it doesn't say why, like that she needed a higher level of care or whatever, or because they're saying she wasn't depressed, that this was just the polypharmacy, blah, blah, blah. So
well,
you
and
can't
maybe
be
that's what it
here.
was. Maybe the referral was, let's weed out whether or not there's a bipolar diagnosis. And if the result of this was, as we can see in this lawsuit, there was no bipolar diagnosis, well, then you don't meet criteria then, or we figured it out. Your reason for admission has come. We have figured it out, right? So
because then they were they're trying to wean her off the Seroquel with her original prescriber, and that prescriber failed to call them back.
Yes. So they reached
Shocker.
out.
I'm shocked. I'm failed to not silo their, failed to like get their ego out of the way and talk to another provider, failed to do that. Like that happens all the fucking time.
Yes.
Like nobody's talking to the other person, and this happens constantly.
Yes.
Constantly.
So then we move her. So then she moves again, and she goes with the other suggestion that had previously been given, which was getting
not funny,
to
but it's funny. I know.
the McLean Hospital. So she
big
decides
inpatient psych hospital.
Yes, this big, huge, fancy inpatient
top
place.
of the line.
It is. I mean, if you look up the information on them within the United States, she'd placed herself in like the cat's ass Taj Mahal of places, right? Like I'm going somewhere. Yes. Like this is what they do. So following that Seroquel reduction, things got worse. And so she said, okay, she admitted herself to McLean Hospital.
I just cannot, because she colored and did puzzles.
Okay. So I got to just take a moment here. So guys, she admitted herself. Oh my God, if you guys are on YouTube. The reason we're laughing about this is because how many times on this podcast have Terry and I talked about inpatient treatment facilities? And what do you do there? You fucking sit and you color. And this is not like we're laughing, but it's not a joke. And we know this because we have worked in inpatient treatment facilities, guys. We have written programming for inpatient facilities. Okay, this is what you do in AODA, is inpatient facilities. You sit and you fucking color. And what did this girl do? Okay, and this is what also just gets my goat, is she admitted herself, guys, it was New Year's. And so there was a skeleton crew there. Oh my God. How many times in the prison system did we say skeleton crew? I read this. I fucking read this. And I had like, just
pins
and needles throughout my body.
It's not our fault that you're having a crisis on a holiday.
Took her 72 hours, guys, to see a provider. And in that time, people colored.
Yep. They colored, and the nurses stayed behind a desk and glass.
Yep. So this is
no interaction.
The nation's top-ranked psychiatric hospital. She's there 72 hours and she's coloring, and nobody saw her. Okay.
But I say this a lot though too. Like it's also designed to make sure that she doesn't hurt herself or take her life.
She was on 15-minute checks, guys. She came in suicidal. She was put on a locked unit. We did the same thing in the prison systems. 15-minute checks, right? So people were walking around. They were checking on her. They were making sure she was alive.
It doesn't mention in here if I'm going to guess that they kept her on the same medication regimen that she was on before. I think they did that for those 3 days.
Yeah, they probably didn't touch it. I mean, a standard of care.
Because on the third is when they told her that the doctor said to stop the Seroquel and the benzos and then prescribe trazodone instead for sleep.
So here we go again with the trazodone. Yep. By the way, the med we already had these adverse effects too, right? Like in the digital world, guys, you can go see a health provider anywhere, and there is an electronic medical record.
Well,
did y'all know this?
That depends. They don't all talk to each other, Jen. They don't.
Well, all right. I guess
depends. The systems. It's this different systems.
Okay, fair. Okay, that's fair. And all right, then I'm going to argue that one and say, then if I'm a provider, do I have the ability to reach out and get records?
Yeah.
100,000. I'm from the nation's top-ranked psychiatric hospital. I mean, shit, that would be like a celebrity calling me and going, Jen, can you work with me? I'd fucking jump all over that shit. Right? Like, okay, somebody is reaching out for records. Like, so there was not, you can't even tell me there was a full record review of this.
No.
Now, the idea of stopping the Seroquel and titrating off of that, if she would have reported, hey, I keep going on this, I increase it, I get worse, I'm decreasing
she probably couldn't even talk for herself at this point.
No, right. So I'm not sure how the information was given and what kind of collateral they had. So guys, we're missing that part. So Terry and I are making some judgments here, right? But the Seroquel gets stopped. the benzos get stopped. So once again, we're
Abruptly.
going to go through fucking withdrawal. We're still going through protracted withdrawal and acute withdrawal from the other 7 medications that we've stopped, but we're going to stop those and we're going to take trazodone for sleep. So she's there one more day. So now we're on the 4th. January 1st is the admission. Okay, here we are. We're on the 4th. What happens?
Yep. She wants to go home.
It's her daughter's birthday.
She wants to go home. It's her daughter's birthday. Yep. And because her thoughts improved, she was discharged.
She was discharged.
Yeah.
So she went off the Seroquel. And because her thoughts improved from that Seroquel.
One day, the doctors told her on the 3rd to stop Seroquel benzos, started her on trazodone. On the 4th, she was better.
She was gone. She's better.
Bye.
So she was discharged. She was discharged from McLean Hospital on January 5th after a 5-day stay. Even though there was, they documented
limited insight and judgment.
That.
Of course she wanted to go home
Sherlock.
for her kid's birthday. Of course she would have wanted to do that. Like, it's around the holiday time, a birthday came, like she was feeling like garbage, I'm sure.
So she gets discharged. The traditional thing in Western medicine happens where she got 10-minute phone call with her doctor who discharged her. Which you'll see this a couple times in this report. They list the minutes that she was with her providers, which again, I say this because we've talked about this on the show. Your average doctor appointment here is going to get you your 15-minute average in the United States. There's twice in here. She got a 17-minute one once and a 10-minute one once. It's information because we say this stuff all the time. People are like, that's such bullshit. No, actually, for most people, that's accurate. Even the nation's top-ranked psychiatric hospital, her discharge was 10 minutes on the phone, and guess what they suggest? Another med.
Amitriptyline. Yeah.
So
another antidepressant in the same classification that caused her to have those adverse reactions in the first place.
So let's do it again. And so here's the gaslighting. Part. Yep, here's the gaslighting.
Are you looking at line 66?
No,
Yeah. I was just in the best hospital in the country, so there was not much hope, she said, when she was discharged. So she decided she must appear like she was okay and had to do her best. She actually realized that everything was very limited there. Yeah.
Yes.
So there's not much hope for me if this is the best that there is, which, by the way, so many people say that, like, I've been to the best of the best of the best of the best, but there's just no hope for me.
There's no hope for me. And that's exactly where she was sitting. So you compile that on top of hallucinations, suicidal ideation, homicidal thoughts, no sleep, anxiety, depression, mania, like all in a few months here. And then at the very bottom of it, it's, I've done everything I can. I've went to the best place in the entire US I can go. And guess what?
It's hopeless.
There isn't hope for me.
Yep. It's hopeless.
So,
but she went back to care again.
So she went back to the same doctor.
Dr. Tufts. So that's a different doctor, though, than the McLean, isn't it? Yeah, Dr. Goodhart from McLean.
Yep. So
that's an interesting name, isn't it?
So McLean was the hospital. Then she went back to Dr. Tuff. That person is who she was seeing originally and had given her that major depressive diagnosis. She's the one that had originally given her the Eidenberg, that she had scored like a 23 on it. And she diagnosed her then with chronic major depression single episode and recorded that this condition was continuing to deteriorate. So she goes back to that same provider.
Well, I wrote on the side of this, treatment resistant. Medication was not effective. Yeah. Despite her poor condition, Dr. Tufts met with Lindsay for 17 minutes.
There we go.
But this is where the treatment resistant stuff, I mean, they didn't say it, but I was like, this is exactly what they're talking about. She's deteriorating, but the meds aren't working despite her deteriorating status, which means treatment resistant.
Yes.
I'm shocked that they didn't do a bunch of ECT or suggest it or any of those things.
So that is one thing throughout this entire thing. And if we get to be able to talking about the hormonal components to this, the metabolic components to this, never once, guys, was this woman, did we do a biomarker assessment of anything?
Any kind.
Never once. Now, if it was done, guys, it's not in here, but I have a really hard time believing that this class action lawsuit didn't list out any kind of scans that were done, any kind of blood work that was done. It does say in here that they never did any kind of blood work to look at toxicity levels from medications in the body.
That's the only thing you said about blood work.
One line.
Yes.
but that wasn't
Yeah.
done. So
Mhm.
instead of looking at this from a postpartum viewpoint, which the average layperson is going to go, hormones, ding, 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 ding.
Of course.
Okay. We're not, this was never considered in this entire case.
How do we not consider hormones in a postpartum case? Like
well, you want to know
I
why?
don't understand.
Do you want to know why? I'm going to tell you why. Oh, this is perfect. I'm going to tell you why.
Tell me.
Let me tell you
Tell
why.
me why,
I'm pulling
Jenn.
something up, guys. That I was chatbotting the shit out of this because this really, I just couldn't wrap my brain around this. Why hormones and looking at hormones are not the standard of treatment when a woman is postpartum. Why are we not looking at any of this? Okay.
Mhm.
According to two chatbots, I'm not going to throw their names out there, but they both said the same thing.
Oh.
And they said evidence has historically been stronger for antidepressants and psychotherapy versus looking at any kind of hormone as a standard treatment. SSRIs are studied extensively and are recommended by many clinical guidelines because they have demonstrated the most benefit in randomized clinical trials versus looking at hormone-based treatments.
Oh, that's fucking horseshit. That is the biggest pile of dookie.
All right, and we know that. Okay, we know that, but
it makes logical sense to look at hormones after like hormonal things. Like,
but they don't.
I know because
how many women do we know? They're not looked at.
Women are
right?
psych patients.
Yes, we so you have a baby, you're going through mental health issues, you're a mental health
PMS.
case. You're going through PMS, you're a mental health case. You're feeling like suicidal 5 days before your period and it never happens, and after a day or two it goes away. Mental health. You're going through perimenopause, menopause, mental health. Your thyroid's fucked up, mental health. So here is a case, right, of like, even when you look this stuff up and you try to I was even trying to ask these search bots to get the answer to the question I wanted. I wanted the answer of we need to look at hormones. We need to look at hormone-based treatments. It still wouldn't give me that answer. Nope. It kept giving me standard-based, most effective evidence-based treatment, SSRIs. Okay, so I have to go on that real quick because I wanted to make sure that got said today. So, all right. So then January 10th, let's keep going. Her hallucinations get way, way, way worse. And they put her on Valium and
to taper the benzo.
To taper the benzo. Now, to be fair, this can be effective. So I got to throw that out there. If we're actually doing a taper, now this taper, this isn't a taper. This is not, this woman's case is so fucking complicated that, like, if it was one drug, if Dr. Yosef were sitting on the show and we're like, there's one drug, that's it. If you were going to taper and you had complications, what would you look at? He would say, well, we might look at having to cross taper. We might have to do a Valium. If Michael Gonzalez was on here, he'd be talking about like some kind of THC based oil that we're going to use to taper, right? These people that, okay, fine. Well, I'll give you that. But this case is not that.
Not that.
It's polypharmacy on crack. So no, sorry. But your little Valium taper to get off the benzo.
Correct.
And then the doctor says, and at some point we will be adding antidepressants.
I'm just like, dude,
okay.
Did you not read anything? Did you literally not read anything? Yep.
And this was her original guys. This was her original doctor. So we're not talking about a whole nother provider like at McLean who was lazy and didn't go get all the records. This was her original doctor. And now is where it gets scary. Really January 16th.
Now keep in mind, she wasn't feeling fear. Keep in mind.
So then the hallucination
January 16th, changes. So we're talking 10, 11 days after she was discharged from the hospital, right? She was discharged on January 5th, I believe. We are now on January 16th. Debilitating depression. She had to force herself to do anything. The hallucinations continued. You should harm the children. You should kill yourself. You will never be the same. The only option is to die. She felt like a zombie.
The hallucinations changed. And now they are command.
They're saying the only option is for you to die.
They started that way, and now the words change again. So if we would go back and just list out Lindsay's words, just her words alone.
Yeah, we should do that.
There's a, I actually did. I threw it all together. And then this morning I was fumbling to find the document. I was like, damn it. So I'm like, I'll
That's
just
funny
talk
'cause
about
that's
it.
pretty
But
smart.
it
Jen's
is.
pretty smart. Yeah.
Well, thank you. Like this
Mhm.
is what I do with my clients, right? Clients' words matter. Like when
Mhm.
you quote a client in something that they say and you put it side by side over sessions and you see the content changing, huge. This is like
Big deal.
safety 101. Safety 101.
Mhm.
Like I don't even,
Yep.
that's why safety assessments, I hate them. I'm going to look at something somebody said over the course of the last how many months, not what this
Because a
little
safety assessment
checkbox
is
said.
today, and
Correct.
most people also
Yep.
understand that if I say the wrong thing, something bad's gonna happen to me, so
So she's
anyway.
a zombie
Mhm.
and she
And
gets
she gets
amitriptyline.
amitriptyline.
Okay.
Another antidepressant. Okay.
Oh God, it's
All right.
so gross. It's so gross.
Mhm.
Little filler information as we speed up because we won't have enough time
Mhm.
to get through this thing. But she starts botting and searching like, what is a psychopath? She
Yeah.
is sitting here herself going, okay, is this what I am? So they can see that on her on the data from her
Because
IRL
she was
searches.
numb and emotionless, and, you know, when we talk about a psychopath or social like, they
Mhm.
can't attach to emotion, so she's wondering, like, "Is this me now? Do I have this lack of emotional connection anymore?"
Yes.
Because my guess is it wasn't just to her, it was also to her children, which they didn't write in here, like, I'm
Yes.
guessing she couldn't attach to her children anymore either, but because when you are in these states, you can't attach to anybody.
No.
You can't.
No.
Mhm.
I mean, if you're just taking an SSRI, one in your life over time, you can't attach to people like that's what this drug does, let alone on and off multiple ones of all of the classes. Like, I
Mhm.
mean, we hit every single class of drug with this woman.
Ugh, just
You
about.
know, I mean,
She missed
okay,
mood
so
stabilizers.
oh, I suppose yes, the mood because of this, because we never caught the bipolar. We
Bipolar,
never
so we
caught the
missed the one
bipolar, so
class.
we never did the.
Mhm,
It's so
mhm.
arbitrary.
It's
It's
so
so
dumb.
ridiculous. Okay, so let's scroll ahead then, and we get to January 24th of 2023. Okay, and she wakes up. She has suicidal thoughts. She has command hallucinations that are going
She didn't
all
sleep.
day.
She did not
Oh
sleep
yeah,
at all
she
that
didn't
night,
sleep.
the 23rd.
Yep.
Mhm,
Yep, and the command hallucinations are saying you should harm the children. So
mhm.
that they're telling her to do this. And
Yep,
so her husband leaves the home and he goes to get some food for takeout. Now, the part of the defense that is
yep,
happening on the part of the state of Massachusetts is that they are saying that this was all planned and that she told her husband to go get food
yep.
because she had put together a plan, pre-contemplated plan to then kill her children and try to kill herself while her husband was out for takeout. And it's because she searched up on the computer, how long will it take for him to get back and
Yep.
forth, or on their phone, how long will it
Even
get
if
back
it
and forth.
was pre-contemplated, she was not in the right mind.
Who who could pre-contemplate this? This is what I'm trying to figure out. Like she doesn't even know what day of the week it is, let alone
That's
put
true.
together an entire
Yeah.
pre-contemplated plan to kill her children and herself. And make up like, do you know how much executive functioning, guys, it takes to do that?
A lot.
A lot. Like you're
Yes.
planning this for quite some time. You got to plan out how you're going to do. Like I can't. We don't have time to go there. But the amount of executive functioning that it would take to put together a plan like this,
Yeah.
and this,
But
I
she's saying that she did it to see how long it would take because she didn't wanna be alone for very
she didn't want to be
long,
alone.
and right.
Yes, she was
Which,
afraid,
I
and
mean, I
that's
can
documented throughout
that
this
feels
thing.
right. That
This
feels
is
right. Like, how long is it gonna
yes.
take for him to get back? Because you know what? I don't trust myself by
This is
myself.
the
I don't
third
trust
time in this
myself.
document it says that she could not be alone and she couldn't
Yep.
trust herself alone. That's the
Yep.
third time it's mentioned in this document. So he goes, he gets the food, and her voices are even louder. The command hallucinations are more demanding, and they tell her to kill the children so she can kill herself. And then it's in bold. It says, "This is your last chance. You have to kill the kids so you can kill yourself."
Then it says she felt a force come over her. Um, I don't know what that was, but it was probably the all-knowing exactly what I had to do, thing to
Yep.
do it. Like, she felt like these voices would not go away until she actually did what they said. And that is common. I've heard that a lot. Like, the voices, they said they wouldn't go away unless I
Yes.
did what they said to do, right?
Yes. And I have also heard many times people saying what she said, which is this complete dissociative state
Mhm.
where you are outside of your. I have watched people do this to
Oh, yeah,
themselves
yeah.
in the prison system
Mhm.
and not bat an eye when harming themselves to a point where anybody else in the world,
Right.
you wouldn't be able to do it, and they
Right.
don't bat an eye. I have
Mhm.
seen this happen in real life. Shit, I thought I was losing my job the day that this happened. Let's be honest.
Yes.
Because of someone being so incredibly dissociated and on a
Mhm.
cocktail of psych drugs. I've watched this in real life happen. So I'm reading this report going, oh my
Oh
God,
my God.
I've seen it.
Mhm.
So
Right.
I have seen this. All right. And so
Yeah.
she describes losing control. Her body takes action. So all of these, right? This happened. And then the hardest part is like, it's almost like this weird state where you're trying to reconcile what you're doing, but you can't stop because you're watching this happen to your own children. And
Well,
then
yeah, because she said it felt like she was outside of her body and just her body was following the commands. She perceived her body was just acting and she was merely watching herself do it. She reported she had no choice but to follow these compelling directives. Losing all control, my body started acting without any control on my part, like her soul's part. Like her
correct.
body was doing this physical thing and her soul was disconnected from her body. I was just following commands, all action. The voice demanded action.
The
Yeah.
next part is really sad and graphic. When she
Mhm.
strangled her children, she said to each one of them, go to God, baby. Right. And she kept saying this to them. She then tried to kill herself. She undertook a severe suicide attempt. So she ingested, it doesn't say what, but it says a substantial quantity of various meds. Well, yeah,
I'm sure
because
she had tons of meds
she
there.
had a whole
Mhm.
pharmacy in her house, right?
Yep.
And then she cut her wrists, self-inflicted lacerations to the wrists, into her neck, and then she jumped out of her second floor window of her
Yeah.
home.
Mhm.
So, all three of her children passed away. You know, if you pull the emotion out of this and you look at what we have in front of us as just facts, it's so tragic that no one could see any of this. We're not, multiple providers, multiple hospitalizations, inpatient programs, suicide hotlines, a doctor that started with her and stayed with her, nurses in between. Like, so much was missed. And people are like, oh, hindsight is 2020. But no,
Yeah,
it's
not
not the
just that,
point of this.
but I think about her trying and trying and trying and trying to get help.
Yes.
Her just like these pleas for help falling flat on a system that is disjointed,
All
disconnected, and believes that meds are the only answer for you. Like, that's
Nobody
it.
could see, nobody in all of this picture could see postpartum. Nobody could see or have even an inkling of, man, like these hormonal changes that are happening to
Mhm.
you. Maybe because of the multiple drugs and it's not working. We got to do something else. Nobody could see that. Well, when you had previous pregnancies, did this happen? Well, I kind of had somebody say, well, what did you do? Well, eat, sleep, move, meditate, right? This is what I did.
Let's start with that. Let's start there.
Nobody got curious enough to look at something outside of Western medicine
No.
prescribing drugs to this
Also,
girl. Nobody.
from what I see in here, there was no therapy at all,
No.
except for some of the quote unquote inpatient
Yep.
whatever.
The only therapy
But
that it says she had was after her second child. And she did
mhm.
a few therapy sessions,
Yeah.
nutrition, meditation, or mindfulness, doing some exercise, things like
Right,
that.
but I mean, during the time of all of this, it was all crisis management therapy type
Yes.
stuff. It wasn't really therapy. Um, yeah, but when people are like, "Oh, her husband didn't give her enough help." I'm like, he was actually the one helping her.
This woman
Like,
was very resourced. She was very
yeah,
resourced, and
she
she did it
was.
herself too. The multiple
Mhm.
times she asked for help, her spouse asked for help, her mother asked for help, the family came in and asked for help.
Yeah.
People were going to appointments with her. It's very
Right,
well documented who was with her on these appointments.
right, right.
She had family. she had access to the nation's top psychiatric facility. She had like she was well resourced, so to say, right? Like
Also, and I'm not trying to blame her, but at being a nurse, like she did
yeah,
probably looked at herself as a psych patient that needed medications.
yeah.
Like
Oh, yeah, she
at
was
some
taught that.
point, I mean, she resisted it in the beginning because of the breastfeeding and all that. And then she succumbed to it and
Yeah.
then was like that I'm just hopeless. Like this is hopeless. And unfortunately, her story, aside from the outcome, is not that dissimilar to many people's stories when they become polypharmacied or even on one medication, right? Like just some of the stuff that she was describing, like being a zombie, not being herself, like all I fucking went through all of that stuff too.
Yeah.
That is not dissimilar to anybody's lived experience, you know?
Yeah.
But the idea that the solution is more medications, like the only person to see that it wasn't was her husband. He was the one saying, "Can't we just start all over?
Yep.
Can't we just take her off of this and start it all over again?"
Mhm.
I wish somebody would have listened to that guy, you know? And, yeah, so as you continue on in this, lawsuit, it was very interesting to me because the lawsuit also is that they lost their marriage, their relationship. That was the other part. Like, she not only lost her children, she lost her relationship with her husband will be forever changed, it said in there, and I'm like,
Mm.
"True." Very
Mhm.
true, because there's no going back. There's
No.
there's literally no going back. So I really I think it's horrible what happened, and I don't wish this on any person, but I hope this becomes some type of case law. And, we sit and talk about holding providers accountable. I hope that this actually happens. I hope that these providers are held accountable for all of this. I'm not sitting in like this is going to be easy or slam dunk at all. But I really do hope that there's some type of accountability and change happens for this case, not just for postpartum women, but for all people and prescribers, because this is not an uncommon circumstance as far as like providers not talking to each other, going someplace else, getting something new. Like anytime you go to inpatient, they're not talking to your original prescriber.
Mhm.
They're taking it all on as their own, like you're a
Yeah.
brand new case to them.
Yeah, guys, I mean,
So
it's not like when we have therapy patients that go inpatient, the inpatient facilities are reaching out to
no,
Terry and I knocking on our door going, "You've been doing
never,
therapy with this person for a year.
never. I
Let's
can
get con
honestly say
let's"
never.
I same. I've
Mhm.
never had that, and yet I've
No.
had multiple patients that go inpatient,
Yep.
right? Or
Yep.
or do even doing an outpatient treatment program, nobody
The only
reaches out to
thing
us, so
the only thing that they will do is right before they're to be discharged, they make sure they have an appointment scheduled. That's it. There was 0 communication during the time that they were in, and so
Mhm.
there's 0 communication between prescribers as
Yep,
well. So
yep,
they literally yank you on, yank you off, do all the things that happened to her.
yeah,
But, the whole postpartum thing, like, it is very serious, and some women go through very serious psychotic episodes, but the research also is showing that if you just don't give interventions like this, it clears up.
yes,
Okay. So there is not definitive research that says psychiatric medication is the answer to these problems. There's more research that points to, I'm going to say this, let it be. Okay? Let it be. Now, when I say that, don't let it be as far as like if you're feeling
yeah,
like you're going to hurt someone or someone else.
right,
Like
right,
get therapeutic help,
and you
work on the
yes, you
basics, the
still need the
foundational
resource,
things.
yes, yes,
Right,
you
you
still need
still
some
need
resources,
resources, but
yes,
piling on medications is not shown to be the solution. It's basically shown that it will remit. It might take a while, but it will remit. You will come back
yeah,
to baseline.
yes,
In the meantime, like, safety and security is profound during that time. I know because I went through some postpartum stuff that was pretty fucking scary. Not to this level of scary, but it was very scary.
yeah,
So I think we need to remember that sometimes the less intervention, more is, the less is
mhm,
more.
mhm,
And things do remit on their own time, right? When you have the right foundational pieces invested in the situation.
yeah,
Going back to her, eat, sleep, move, meditate, and a few therapy sessions, boom, she was back.
yep,
Wonder what would have happened if that would have been the case for her again. That type of support instead of all the psychiatric medications. you know, or blaming her again, you know, she's treatment resistant. Nothing helps her. She's unhelpable. Like that psychologically, I think was damning to her when she left McLean. The idea that she was hopeless and unhelpable, that was a
Yes.
psychological damage. But that was because she is in medical and she believes that, you know, this
Right.
is what's supposed to help me. And everyone's telling
What we
her
were
that this is
what we
what's
were
supposed to help
taught.
you.
It's what we were
Yeah.
all taught, right? Yeah,
Mhm.
so you can't short her for that. Absolutely.
No. No.
So, well,
Tragic.
we're gonna have to wrap up, guys. Yeah, this has been Terry and I felt like we needed to talk about this one just from multiple different standpoints, right? It's from the women's health standpoint, it's from the hormonal standpoint, it's from the like percentage of women, the high percentage of women that go through this after having children. And
Mhm.
what the standard of care is, right? We needed to talk about this from a psychiatric medication standpoint. We needed to talk about this from an ethical standpoint. As therapists, we needed to talk about this from what we've seen standpoint. So there's multiple layers to why this was important. The last one I think is for anybody who is in a position like this, take this information in, consider what you're doing for yourself.
Mhm.
Honestly, for anybody who is going to be having a child and postpartum is it's not the week after you have the baby.
Can be up
Postpartum
to like 2
goes
years.
for 2 years,
Mhm.
18 to
Mhm.
24 months after you have your child. So consider this information, take it in. You
Mhm.
know, it just because what we say is not the thing, it's a thing, right? It's not the thing, but you need to be aware of this. So I think that's a bigger take home message too, is any woman who is out there who's in a position like this, consider this. Consider that that's actually what could be going on.
Mhm. Yeah.
Yeah. So
Anyway, well, if you're struggling, please reach out for help, and get the right help.
yeah,
Right?
yeah.
Get the
Get,
right
get
help.
get the help that you need, not the help that everybody seems to tell you that you need, and you go with your gut and you follow that because it's
Like, literally,
usually
if they're stopping, starting, changing all the stuff medications, maybe that's the time to step back and be like, "All right,
Mhm.
this is not it. This is
Yeah.
not it." So, yeah.
Yes.
Anyway, all
Okay.
right. Well, thanks for hanging out with us for this long, a little bit longer of an episode, but we appreciate you all being here. Please like, comment, subscribe, share, do all the things. And don't forget to send us your gaslit truth at the gaslit truth podcast at gmail.com.